I'm Philip Ward, Editor-in-Chief of Aunt Mini Europe at ECR 2019. One of the sessions that really caught the eye on the first day was about screening, a special focus session on how to optimize screening. One of the speakers was Professor Mathias Prokop from Nijmegen in the Netherlands. Mathias, thank you very much for joining me here today.
You're welcome.
Good. I was going to start by just asking if you could include a brief summary of your talk and to mention about the current situation, to describe the current situation for lung cancer screening with CT in Europe.
I would say that at the moment there is a really uplifting spirit because we have heard last year at the Toronto meeting a positive result of the Nelson study, which actually showed for men a 25% reduction in mortality, actually a significant result and even larger than the one from NLST, which basically means as soon as it's really published, it's not yet published, it was a paper presented there, it will probably change the policies in many of the European countries because now we have two large randomized controlled trials, one of which is European, so that actually pushes us towards lung cancer screening.
Okay. I suppose the difficulty is how to target screening. How are you approaching that? How would you recommend the approach on that, on targeting screening?
You mean on targeting the right people?
On who you actually screen,
yeah.
Yes. Yeah.
I think it's a very interesting question because you can go to two extremes if you want. If you look at a way of screening most cost effectively, you would like to include the high-risk population. So before you start screening, defining a population that has a high chance of developing lung cancer within the coming years. We have seen that the classic way we do it, like the Nelson did it or NLST did it, with age and smoking history as the main criteria, is not very efficient. The rough really yearly rate in NLST was 0.6%, in Nelson it's only 0.3% because the risks were lower. If you use more complex risk modules like the Liverpool model or the PLCO model, then you end up way above 1%. PLCO is 1.3 and the other one 1.7 per year. So that actually gives you a much higher risk population, which means that you get a bigger bang for the buck. The amount of money that you have to spend in order to have an effect will be smaller, and you of course get relatively less side effects because the population as such is potentially sicker.
Okay. Now for any of our readers, any listeners here today who are looking at starting screening or getting involved with the screening program, what advice would you have for them?
Wait a bit, because we need first real approval. One of the biggest issues that we are all facing when it comes to screening is the pickup rate of our clients, patients. Actually, they're not patients yet. What we do see is that those who need screening the most often also the most reluctant. Obviously, it's males, and we have seen that by targeting not a male smoker, but his wife, is much more effective than targeting the male itself, because she will push the people to do the right thing. We see, by the way, similar things in colon screening. Men are pushed by their wives to do the good thing. So
how do you target the women? Do you through selective advertising?
We don't really know what
marketing?
the best is. Let's say if it's a non-governmental screening, it's good marketing that you need to have. I think the story at the moment is pretty strong. When it is government screening, it's the question, how do you get as many potential people that would benefit from screening into the program? What makes it attractive for them? What makes it easy for them? So having easy access to a screening facility is, I think, an important factor. And the buck factor is also important. Just taking the first step to go there and do that. So in Holland, we are looking at family physicians as a potential first point of entry, but haven't really decided what is the best way of doing it at the moment.
Now, I suppose quality assurance and standardization are very important issues in any screening program. Is that the case?
Also the case here. We see that the European Society of Thoracic Imaging, ST, is coming up with a training program for people who want to read screening breathing chest CTs. Also for understanding how to perform them. Actually, if you want to do real screening, it is a technique that can be done high throughput, so you can do up to 10 or even more patients per hour if you do it well. which really reduces the cost and increases the effectiveness.
Excellent.
All these things we're going to train.
Yeah. And how about radiation doses? That's always a concern. Do you think enough measures are now being taken in screening for that to be less of a concern, less of a factor?
In principle, it's still a concern with the equipment many people have out on the market. When you take the technique that NLST or Nelson have used, we end up around 1 millisievert exposure, which is quite high compared to what we can achieve now. Nowadays, we can go well below 0.3, even to 0.15 millisievert, which is the same range that you'd expect from a single flight, transatlantic flight across the pole to, say, Japan. That's roughly the same dose you get. That is something that's really acceptable and is almost negligible. So once we come to this area, it's pretty easy. But you require machines that are not super cheap. So you need machines that are able to go to these low dose ranges and really provide still adequate image quality.
Okay, excellent. Now on a different topic, you're known as one of Europe's leading researchers, very excellent track record. Do you have any advice for our viewers on how to conduct a research program? For example, if they're not, is there a single tip that you have for people?
It's of course always difficult, but think well of what you tackle. I think that's having a good idea is probably not enough, but really making sure that it has also potential impact and looking at that. And then the second or most important thing is find good partners. If you want to have a significant impact, you have to do it together with others, and only then you will succeed.
Excellent. Well, thank you very much for joining us. I hope the rest of the Congress goes well for you. And this is Philip Ward signing off for Mini Europe.